Hey everyone, welcome to another edition of Medicare Mondays. I'm your host, Joseph Katz, here again with CoverRight co-founder, Richard Chan. How are you, Richard?
I'm well, Joseph. Good to be back. Good to be talking about Medicare.
Excellent, excellent. Always good to be talking about Medicare. So I thought today we'd talk a little bit, have a little fun, and talk a little bit about how to avoid becoming a Medicare statistic. And there's lots of numbers that get thrown around about Medicare. And, you know these, maybe some other folks don't, but 10,000 people a day turn 65. So there's one statistic. I saw a number, 29 million people are on a Medicare Advantage plan. And there's probably many other statistics. But there are probably a bunch of things to avoid so you don't become a Medicare statistic in a negative way. So, Richard, what couple of ideas would you share with our listeners about Medicare to help them make a better choice?
Yeah. Well, the first statistic that's probably relevant is there's probably the last number I saw was close to 1 million people, but 1 million people who are on Medicare who are paying late enrollment penalties. Now, that is a mistake that everyone should avoid. It's an easy one. And that really comes down to knowing when you need to enroll in Medicare. Now, if you're turning 65, the period that most people hear about is the initial enrollment period, 7 months around your 65th birthday. There's a lot of nuances, but the key thing is when you get to that 3 months before your 65th birthday, reach out to an expert like CoverRight, come to our platform, you can read about it. There are situations where you can defer enrollment in Medicare, but there are also a lot of situations that people don't know and they need to enroll, and the penalties get quite high. It's 10% a year for every year that you're late for the Part B, which is the key medical coverage.
And those are lifetime penalties, so they add up.
That's right. They're lifetime penalties. You incur them for as long as you stay in Medicare, which for most people is sort of the remainder of their life.
And then how about the drug plans? I know there's so many different options to choose from.
Yeah. So one other key statistic is that 9 out of 10 people are not in the lowest cost drug plan. Now that's a very interesting statistic because it's actually, if you go to the right sort of Medicare insurance platform or broker, like they can help you with that very easily. Drugs cost differently across different plans. The way it works in Medicare is each carrier or each insurance plan will tier certain. Your drug could be tier 1 for one carrier and tier 3 for another carrier, and tier 3 typically costs a lot more. And so a lot of people think that, I just have these medications that they'll cover pretty well in group insurance. They should be about the same in Medicare. That's a very big mistake. That could cost you hundreds of thousands of dollars a year.
So basically, if you don't want to become a Medicare statistic, you need to speak to someone who knows the ins and outs of the various programs, policies, terms, etc., so that you check all the boxes that need to be checked on time and in order. If anyone has any questions about Medicare, you can always reach out.
And come to CoverRight, we have our. Oh, sorry, cut you off there, Joseph. I was like, come to our learning center. We've got Medicare videos that cover all these topics, and also obviously speak to an expert once he gets more nuance.
Yep, I think we had a little time delay there on the recording, so apologize. But yeah, anyone can reach out to hello@CoverRight or reach out to learning.coverright.com and get access to all of our materials. And we'll be here every week talking more about Medicare and how to make sure you make the best choice for you. And I think the key there is that what's right for one person is not going to be right for the next, just based on their personal health and wellness and needs as it relates to medical coverage. So thank you, Richard. Appreciate the time, and we'll see you soon.